Which short-acting beta-2 agonist is the rescue drug of choice for acute asthma? Salbutamol, albuterol. Remember, Salbu saves sudden spasms. Name the inhaled corticosteroid that has highest first-pass hepatic metabolism, reducing systemic effects in children. Ciclesonide. Remember, sickle tames child lungs. Which monoclonal antibody targets IgE for severe allergic asthma? Speak, prosody rate 100%, omalizumab. Remember, Omali ousts Ig. Tiotropium acts on which muscarinic receptor subtype to produce bronchodilation? Speak, prosody rate 100%, move on, tab. Remember, TIO turns M3 mute. Which phosphodiesterase 4 inhibitor is approved for severe COPD with chronic bronchitis phenotype? Roflumilast. Remember, raw flu relaxes lungs. Zilutin inhibits which enzyme in leukotriene synthesis pathway? Speak, prosody rate 100%. Remember, Xyl zeros 5 locks. Which long-acting beta-2 agonist must always be combined with inhaled corticosteroid in asthma to avoid mortality risk? Speak, prosody rate 100%, salmeterol or formoterol. Remember, Salmi needs steroid sidekick. What adverse effect limits long-term systemic corticosteroid use in asthma children? Growth suppression. Remember, steroid stunts stature. Mepolizumab targets which interleukin to reduce eosinophilic airway inflammation? Speak, for to stop, interleukin 5, IL-5. Remember, Nepo masks IL-5. Which inhalational propellant can precipitate acute cough if inhaled too cold? Speak, prosody, hydrofluoroalkane FFA blast. Remember, HFA, harsh first air. Give one first-line drug for exercise-induced bronchospasm taken 15 minutes before activity. Speak, prosody rate 100%, salbutamol inhalation. Remember, Salbu suits sports. Which oral leukotriene receptor antagonist is safe from age 6 months for allergic rhinitis? Speak, prosody rate 100%, montelukast. Remember, Monty mild for minis. Eophilin plasma concentration for therapeutic bronchodilation is within what range, micrograms per milliliter? 10 to 20 micrograms per milliliter. Remember, Theo 10 to 20. Which rescue drug reverses life-threatening bronchospasm unresponsive to inhaled beta-2 agonist and oxygen? Speak, intramuscular epinephrine. Remember, epi ends extreme asthma. What is the most common adverse effect of inhaled ipratropium? Dry mouth. Remember, Ipra parches palate. Dupilumab blocks IL-4 receptor alpha subunit. Name one added clinical benefit besides asthma control. Atopic dermatitis improvement. Remember, Dupy does derm too. Which nebulized agent acts as mucolytic by breaking disulfide bonds in sputum? N-acetylcysteine. Remember, NAC-NICS mucus nets. What parameter guides adjustment of inhaled steroid dose in stepwise asthma therapy? Personal best peak expiratory flow, PEF percentage. Remember, PEF plots steroid plan. Which biologic targets IL-5 receptor alpha and is given subcutaneously every 8 weeks? Enrolizumab. Remember, Benra binds IL-5R. Give the GOLD AD classification parameter based on exacerbation frequency or CAT score. Speak. More than 2 exacerbations or CAT moves to group C, D. Remember, GOLD grades by 2 or 10. Which class of drugs irreversibly blocks H+, K+ ATPase in gastric parietal cells? Speak. Proton pump inhibitors, PPIs. Remember, PPI plugs proton pump. Name the PPI with least CYP2C19 interaction, making it safer with clopidogrel. Speak. Pantoprazole, pantoprazole. Remember, panto pairs with clopi. Which H2 blocker causes most anti-androgenic effects, e.g. gynecomastia? Cimetidine. Remember, sign changes chest. Metoclopramide exerts prokinetic action by agonism at which receptor? 5-HT4 receptor and D2 antagonism. Remember, meto moves via 5-HT4. Which 5-HT3 antagonist is first line for chemotherapy-induced nausea and vomiting? SPE ondansetron. Remember, Onda outwits emesis. Sucralfate requires which gastric pH range less than 4 to polymerize and form protective gel? S-peak, porosity rate 100%, 4. Speak. Remember, sucma sticks in strong acid. Which antisecretory drug is safe in pregnancy for GERD relief? Ranitidine, now withdrawn many places but accepted. Famotidine safer. Speak. Porosity rate 100%. Remember, Famo fine for fetus. Prosody, speak. Loperamide should be avoided in children under which age, years, due to ileus risk? 2 years. Remember, Loper limit under 2. Which osmotic laxative is a non-absorbable sugar safe for hepatic encephalopathy? Lactulose. Remember, Lactu lowers ammonia. Aprepitant blocks which receptor to prevent delayed CINV? Neurokinin 1, NK1 receptor. Remember, Apre averts NK1 nausea. Misoprostol is contraindicated in pregnancy because it induces what? In speak, porosity rate 100%. Uterine contractions leading to abortion. Coprosity. Remember, miso may move uterus. Which dopamine 2 antagonist prokinetic crosses BBB least, reducing EPS risk? Speak. Prosody rate 100%. Domperidone. Remember, DOMPE, distant from brain. Which PPI has shortest half-life, yet 24-hour suppression due to irreversible binding? Omeprazole. Remember, OMI stays despite short. Name one alarm feature in dyspepsia mandating endoscopy before PPI trial. Speak. Unintended weight loss, dysphagia, anemia, GI bleed, any one. Prosody. Remember, red flags need scope. Octreotide controls variceal bleed by constricting which splanchnic vessel? Portal vein via splenic artery vasoconstriction. Remember, octrate closes portal flow. Which mucosal protectant chelates bile acids and binds pepsin, useful for NSAID ulcers? Bismuth subsalicylate. Remember, bismuth blankets bile. Linaclotide treats constipation by agonizing which intestinal receptor? Speak. Guanylate cyclase C. Speak. Remember, Lena lifts GCC. Which antibiotic in H. pylori therapy can cause disulfiram-like reaction with alcohol? Metronidazole. Remember, metro minus malt. Excessive PPI use predisposes to deficiency of which mineral leading to fractures? Magnesium, also calcium. Remember, PPI mines magnesium. Give 1,5-ASA prodrug used in ulcerative colitis that releases drug in colon due to azo bond cleavage. Sulfasalazine. Remember, sulfa splits in colon. Which emetic act blocks D2 and 5-HT3 and is used for refractory CINV? Name one phenothiazine. Speak. Prochlorperazine. Remember, proc stops puke. Speak. What is the mechanism of lubiprostone used in IBS-C? Prosody. Speak. Activates ClC2 chloride channels, increasing fluid secretion. Remember, lubi loosens stool via clow. Name the antiemetic safe for hyperemesis gravidarum combining vitamin B6 with antihistamine. Doxylamine plus pyridoxine. Remember, doxylam plus B6 beats vomit. Which opioid receptor agonist is used as antidiarrheal but crosses BBB, causing dependence risk, hence Schedule X? Speak. Prosody rate. Diphenoxylate with atropine. Then speak. Remember, dip slows stool, risky. Ondansetron may prolong which ECG interval requiring caution with QT drugs? Speak. Prosody rate 100%. QT interval. Remember, ONDA often lengthens QT. Propylthiouracil inhibits thyroperoxidase and which extrathyroidal step? Peripheral conversion of T4 to T3. Remember, PTU prevents T4 to T3. Which anti-thyroid is preferred in first trimester pregnancy? Propylthiouracil. Remember, PTU picks pregnancy early. High-dose iodine produces acute inhibition of hormone release, known as what effect? Wolff-Chaikoff effect. Remember, iodine causes Wolff stop. Hydrocortisone equivalent anti-inflammatory dose of dexamethasone 0.75 mg equals how much hydrocortisone milligrams? 20 mg hydrocortisone. Remember, 0.75 dex, duration 20 hydro. Which selective mineralocorticoid receptor blocker improves survival in HF post-MI? Eplerenone. Remember, Epler enters post-MI plan. Porosity rate 0.100%. Teriparatide is analog of which hormone fragment stimulating bone formation? Speak, porosity rate 100, PTH 1 to 34, porosity. Speak. Remember, Teri tiny PTH piece. Denosumab targets which ligand to inhibit osteoclast formation? Speak, FRANGL. Remember, Dino dumps rankle. Which SERM reduces vertebral fracture risk and lowers breast cancer incidence? Raloxifene. Remember, mallow rocks bones. List one absolute contraindication for combined oral contraceptive pills. Active breast cancer, thromboembolism, severe liver disease, any one. Remember, COCP no with quats. Emergency contraception dose of levonorgestrel 1.5 mg must be taken within how many hours post-intercourse? Speak, porosity rate 100%, 72 hours. Remember, Plan B within 72. Nifepristone acts as competitive antagonist at which receptor? Speak, porosity rate 100%, progesterone receptor, also glucocorticoid. Speak. Remember, Mife blocks progesterone. Which long-acting insulin analog forms multi-hexamers for flat 24H profile? Speak, porosity rate 100%, insulin glargine. Remember, glargine gives glassy line. Fludrocortisone is used primarily to treat deficiency of what hormone? Say the following text. Aldosterone, Addison's disease. Remember, flood fills Aldo gap. Which bisphosphonate is given yearly IV for osteoporosis? Speak, zoledronic acid, Partio. Remember, Zol once yearly bones. Calcitonin lowers serum calcium by acting primarily on which cell type? Osteoclasts. Remember, calci calms clasts. What is first-line drug for myxedema coma along with hydrocortisone? Speak, porosity rate 100%, IV levothyroxine. Remember, T4 lifts coma. Prednisone long-term can suppress axis, taper to avoid crisis of which glandular axis? Speak, hypothalamic pituitary adrenal, HPA axis. Remember, taper to save HPA. Speak, which drug inhibits 17-alpha hydroxylase, and is used in Cushing's when surgery not possible. Speak. Ketoconazole high dose. Remember, keto kills cortisol. Desmopressin is analog of which posterior pituitary hormone? Arginine vasopressin, ADH. Remember, desmo double for ADH. Carbimazole is prodrug converted to which active anti-thyroid? Methimazole. Remember, carby makes methy. Speak. Prosody rate 100%. What is the black box warning for teriparatide limiting use to 2 years? Prosody. Speak. Risk of osteosarcoma. Prosody. Remember, Terry time 2 years. Bromocriptine shrinks prolactinomas by acting as agonist at which receptor? Speak. Prosody rate 100%. Dopamine D2 receptor. Remember, bromo boosts D2. Name the once-weekly GLP-1 receptor agonist causing weight loss up to 10 kilograms. Semaglutide. Remember, SEMA Slims Weekly. Which vitamin D analog is preferred in renal osteodystrophy because it does not require 1-alpha hydroxylation? Speak. Prosody rate 100%. Remember, calci ready active. Fulvestrant is classified as what type of estrogen receptor modulator? Selective estrogen receptor downregulator, SERD. Remember, fully downreg estrogen. Ulipristal acetate emergency pill acts as modulator of which receptor? Speak. Progesterone receptor antagonist, partial agonist. Remember, ULI uses progesterone switch. GnRH agonist leuprolide given continuously suppresses which pituitary hormones? Speak. Prosody rate of 100%, LH and FSH. Remember, LEAP lowers LH, FSH. Which SGLT2 inhibitor lowers risk of hospitalization for heart failure in diabetics per EMPA-reg? Empagliflozin. Remember, EMPA eases hearts. Orlistat causes fat malabsorption by inhibiting which enzyme? Pancreatic lipase. Remember, Orly obstructs lipase. Speak. Ochronotropin therapy is contraindicated in which ocular complication of diabetes? Speak. Proliferative diabetic retinopathy. Remember, growth harms retina. Which long-acting reversible contraception releases levonorgestrel over 5 years when implanted in arm? Speak. Prosody rate 100%. Nexplanon etonogestrel rod. Speak. Remember, implanon in arm years. Oxytocin overdose during labor can cause which electrolyte imbalance due to ADH-like effect? Hyponatremia. Remember, oxy floods water. Cabergoline has longer half-life than bromocriptine. Name one added advantage. Speak. Prosody rate 100%. Once weekly dosing, less nausea. Speak. Remember, Caber, comfy weekly. Metropone inhibits which adrenal enzyme to test pituitary ACTH reserve? 11. Beta-hydroxylase. Remember, METI maps 1B stop. Which insulin regimen mimics physiologic secretion using pump with rapid analog? Continuous subcutaneous insulin infusion, CSII. Remember, pump provides basal bolus. Octreotide is used for Cushing's disease by agonizing which somatostatin receptor subtype? Speak, prosody rate 100. Speak. Remember, PASI prefers 5. Alendronate must be taken with full glass water and remain upright for 30 minutes to avoid what adverse effect? Esophagitis, esophageal ulcer. Remember, Alin avoid acid burn. Thyroid storm first-line pharmacologic blockade of sympathetic surge uses which beta blocker? Propranolol. Remember, prop pacifies storm. Conivaptan antagonizes which receptors to treat SIADH hyponatremia? Speak, prosody rate 100%. Vasopressin, V1A and V2 receptors, prosody. Remember, Connie cuts V2. Which selective estrogen receptor downregulator is FDA approved for ER-positive metastatic breast cancer resistant to tamoxifen? Fulvestrant. Remember, fall fights after TAM. Name the first oral GnRH antagonist for uterine fibroid heavy bleeding. Elagolix with add back is add back. Speak. Remember, Eli-Ag eases bleed. Somatostatin analog octreotide treats acute variceal bleed by reducing portal pressure. Give typical IV bolus dose. Speak. Prosody rate 100%, 50 micrograms IV bolus. Remember, Octary 50 Bolt. Which synthetic T3 preparation is used for rapid action in myxedema coma? Speak. Prosody rate 100%, liithyronine, prosody. Remember, Lyo lives fast. Raltegravir belongs to which endocrine-related HIV drug class? Distractor high-yield cross? Speak. Prosody rate 100%. Integrase inhibitor, not endocrine, prosody. Speak. Remember, Ralti breaks chain. Magnesium hydroxide antacid causes which bowel effect? Speak. Prosody rate 100%. Diarrhea, osmotic laxative. Remember, MG makes go. Which endocrine drug mimics incretin and is delivered as weekly implantable hydrogel? Study. Speak. Prosody rate 100%. Icosema icodex semaglutide, experimental. Remember, ICO future weekly mix. Calcitonin salmon nasal spray is FDA approved for pain relief of which acute skeletal condition? Acute vertebral osteoporotic fracture. Remember, salmon soothes spine. Micronized progesterone added to estrogen HRT prevents which malignancy risk? Endometrial carcinoma. Remember, Prague shields womb. Which short-acting somatostatin analog controls carcinoid flushing? An alitrotide, long-grown, accept octreotide. Remember, octocryl cools carcinoid. Thyroxine dose must be increased in pregnancy starting which trimester? First trimester, as early as confirmation. Remember, T4 top early bump. Which vitamin D analog treats secondary hyperparathyroidism by activating VDR but lowering PTH? Paracalcitol. Remember, peri-paris, PTH. Somatotropin excess drug pegviscement acts as antagonist at which receptor? Speak, growth hormone receptor. Remember, PEGV plugs GH receptor. Which oral calcium mimetic treats hypercalcemia in parathyroid carcinoma? Cinacalcet. Remember, Sina sensus ka false. Meterpone test rise in ACTH suggests integrity of which gland? Anterior pituitary. Remember, ACTH astometi equals pit OK. Which bisphosphonate is given IV monthly for tumor-associated hypercalcemia resistant to hydration? Pamidronate. Remember, PAMI pacifies Ka.